Hello and welcome to this week's edition of Health Talk. Now, World Health Day is marked on the 7th of April, and this year the theme is building a fairer, healthier world for everyone, everywhere. Coming up on the program, our senior producer, Zama Buthelezi, spoke to South Africans asking them if they have or will be taking the flu shot this year. Then we speak to a general practitioner about the influenza and the importance of taking the flu vaccination ahead of the influenza season and the effects of the possible third wave of COVID-19 during flu season. Again, Zama Buthelezi spoke to a health coach and wellness chef about what to eat when you have flu and what to avoid. And then finally, we get advice from our regular doctor on the program to answer some of your COVID-19 related questions. A lot of the ones that you put on social media and you just don't know who's answering those questions. So we decided that we're going to get you some professional advice to make sure that you're getting the right messaging around what to do and how to deal with some of the symptoms that you have. Okay, let's connect now with Zama Buthelezi, who's going to tell us all about the COVID-19 numbers. And I've got a feeling, Zama, that we're starting to pick up.
We are starting to pick up, Peter, with the infections, but also sadly, even the number of people who are succumbing to the virus, the number is really picking up, which is quite sad. A very good morning to you, Peter, and Health Talk viewers. While active cases remain stable over the last week, experts fear gatherings and travel using public transport over the weekend might lead to an increase in infections over the next week or two. Globally, more than 132 million positive cases have been reported. More than 75 million people have recovered, but sadly, more than 2.8 million people succumbed to COVID-19 related illnesses. South Africa is still leading with the infections in the continent. According to Health Minister Dr. Zwelini Mkhize, the Pfizer agreement for 20 million doses of vaccines has been signed and that the payment process are underway to close the deal in the next few days. With the Johnson & Johnson agreement also fully concluded, this sets the stage for a significant and rapid expansion of South Africa's vaccination program. But for now, let's take a look at the national COVID-19 statistics. To date, more than 10 million tests have been processed in South Africa. More than 1.5 million positive cases have been recorded. More than 1.4 million people have recovered, bringing the recovery rate to 95%. More than 21,000 active cases have been recorded, but sadly, more than 53,000 people have died from COVID-related illnesses. While we are seeing a 95% recovery rate, 4 provinces with big metros continue to record the highest numbers of COVID-19 infections a year later, as well as new infections and deaths. Let's take a look at the infection numbers recorded in the provinces to date. Leading is the Gauteng province with more than 416,000 positive cases, followed by KwaZulu-Natal with more than 334,000 positive cases. At number 3 is the Western Cape with more than 283,000 positive cases. At number 4 is the Eastern Cape with more than 195,000 positive cases. The following provinces were recording the lowest numbers, but these increased sharply during the holidays. That was last year, December. The concern last week was that super spreader events allowed over Easter may trigger a tide of new infections. But for now, let's take a look at the total infection numbers recorded by these provinces just a little over a year later. More than 84,000 positive cases have been recorded in the Free State. More than 75,000 positive cases have been recorded in Mpumalanga. More than 64,000 positive cases have been recorded in the Northwest. More than 63,000 positive cases have been recorded in Limpopo. More than 36,000 positive cases have been recorded in the Northern Cape. Some experts have warned that the third wave of COVID-19 infections is looming in South Africa, and human behavior is what will determine whether South Africa gets the next waves. This will also determine the severity. We are all still urged to continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. We must all continue to wear a cloth mask that covers both our nose and mouth in public. We must continue to practice social distancing and ensure proper ventilation indoors. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline for information. The number is 0800 029 999 and alert them to your symptoms. Protect yourself to protect others. Thank you so much, and back to you, Peter.
Are you getting a flu shot?
Definitely.
Yeah, I'm definitely going to get one. It's actually going to be my first one this year.
Me too. It will be the first one.
I've never had it before. I'm not taking any chances whatsoever.
It took COVID for me to build the strength.
No, you're so right. And also, these are my weapons, hey?
I've got them also in my car, in my bag, everywhere.
It's important, isn't it, hey? Wow.
Very important.
Cool. Go wash your hands.
Definitely.
Thanks. All right, thanks so much indeed, Zama. And remember that as we observe and report on these COVID-19 cases, the numbers can sometimes change, and sometimes even significantly. And this, of course, is something that you've seen this past year. Now, remember, you can also be part of the show, asking our guests some questions that you might have on your mind, or perhaps you might just want to share your views on some of the issues that we're discussing. And the number to call is Johannesburg 011 714 5861 or 5877. That number again, Johannesburg 011 714 5861 or 5877. We look forward to hearing from you. You can also share your thoughts with us on social media as well, and our Twitter handle is @SABC Health Talk or #SABC Health Talk, and we're also on Facebook, and there you can find us at SABC Health Talk. And again, please comment, share your thoughts. We look forward to perhaps reading some of those out as well. I'm Peter Ndoro. Health Talk continues right after this. Welcome back. You're still watching Health Talk. Now, influenza kills about 10,000 people of 5 years and older each year in South Africa, a relatively small number compared with the past year's COVID-19 deaths, but still, that's quite a heavy toll. Furthermore, worldwide, it causes between 3 and 5 million cases of severe illness and 290,000 to 650,000 deaths. Health Talk producer Zama Buthelezi spoke to South Africans, asking them if they will be taking their flu shots this year. And this is what they had to say.
I won't be taking them because I don't have money, you see. Yeah, if maybe they were for free, then maybe there was a possibility. But now to find out that for you to get them, you need to go pay. So I don't have that money.
I would like to take it because it's a flu vaccine that can protect me on getting flu.
Where we are as a country, the minute you have any flu symptoms, you can be easily diagnosed with COVID. So I'm trying to avoid that whenever I have flu symptoms, I go to the clinic or I have to go to the hospital where it's just flu, and I might just end up catching it at the hospital or clinic. So that's why I'm going to take the flu shot.
Yes, because I want to protect myself. I don't want to get infected by someone else. So if I've got a vaccine, I think I'm going to be protected.
Yes, I am going to take it. I am a full-time student and I live in a very populated area, so I just want to be safe.
Ngisazocabanga cause kwamanje ngisengakabi ready for ukuthi ngathi ngiyothatha that vaccine yobona kusafuna ukuthi ngiqale ngiunderstand kancane ngibe ngicabange dana ukuthi ngimane ngigijime nje ngiyothatha ivaccine ngisengakabi prepared for me.
All right, so after the break, we'll be speaking to Dr. Marlin McKay, a general practitioner, about influenza. So stay with us. That's a really important conversation still to be had. You're watching Health Talk. Now, over the past year, South Africa has been ravaged by COVID-19, and to date, more than 1.5 million cases and sadly, more than 50,000 deaths have been confirmed, with ongoing community transmission and subsequent error-prone viral replication. New variants of SARS-CoV-2 will probably emerge and may further the transmission process. Now, none of us knows when the third wave will hit, but most people in the public health sector and science believe that South Africa's COVID-19 vaccination rollout will not be quick enough to prevent this or subsequent waves. So, if the next wave coincides with the winter respiratory virus season, particularly a seasonal flu epidemic, a double whammy will hit South Africa and our health system. Dr. Marlin McKay, general practitioner, joins us now for a discussion on influenza. A very good morning. Good to talk to you as always. And we in the flu season. I want to go back though to this time last year, and for some reason we didn't have so much flu. What was that about?
Yeah, thanks, Peter. For a number of reasons. If you remember at the time, this time last year, we were under hard lockdown. So we were all confined to our homes. Everyone, only those with only those essential services where the permits could move around. So that already limited the amount of people in terms of exposure. Secondly, we were very, very good with masking, washing our hands, social distancing. Everything that we have been telling our patients to do every year to prevent influenza finally took place last year. And because of those preventative measures, masking, social distancing, and the hard lockdown, there was just no flu. We did not have any flu epidemic, any cases of flu for the whole season. And that was for the first time in 28 years in practice. First time I did not see any flu patients. So it's amazing how the COVID-19 pandemic actually assisted us and avoided patients getting influenza.
But this season, you're expecting a different story.
Absolutely. So, and again, the opposite now. So we are no longer under the hard lockdown. We are going into the winter, as you said, the winter influenza season. Many of us have become complacent. You only have to look around to see people are not so strict as in terms of wearing masks, sanitizing, hand washing, which is absolutely even more critical to influenza compared to COVID-19. So I think the apathy, the lethargy, the timing, flu season, and again the second wave, or third wave of COVID that we're anticipating, really it's just creating the perfect storm, the perfect environment for a major flu epidemic.
All right, so now, before we start talking about influenza proper, I do think as lay people, we often use the word flu, influenza, and a cold interchangeably, but they're not the same thing, are they?
Absolutely. Patients will come in and say, "Doctor, don't worry, I'm not too bad. I just got the flu," and they expect treatment. And so let's take a step back. What exactly do you mean by flu? And you're absolutely right. So let's start with the common cold. Is called that because it is so common, and one can get, especially in kids, 8 to 10 attacks of the common cold throughout any year. It has three main symptoms: a cough, runny nose, and sore throat. That's it. That's a common cold. It can then even subside or go away on its own without any treatment. Whereas influenza is a severe illness. It is characterized, Peter, by an acute onset. So many people say, at 3 o'clock I was fine, doc, and then at 3:10, suddenly I had these hot and cold shivers, these rigors. I felt like a bus hit me. So severe generalized body pains, severe headache, high temperature, dry cough, bit of a sore throat, massive headache, not much in the nose. So common cold, it's common you're not that ill, but with the influenza, you are very, very ill. And you just want to be in bed in a cold, dark room, and you feel absolutely miserable. And then the other one that also confuses people is allergies, sinus, so-called sinus that we talk about. And that's more has the sneeze. So a sneeze, itchy nose, runny nose, blocked nose, bit of a post-nasal drip. That is sinus. Common cold, cough, sore throat, runny or blocked nose, and then influenza. Serious, quick onset, high temperature, bad headache, sore throat, bit of a dry cough, not much going on in the nose.
All right, let's talk about the influenza now, because that's the one that we worried about, because it can be fatal, can't it?
Oh, absolutely. And you can see, so it's not as high, we don't lose as many people with COVID compared to influenza, but it's still over 10,000, up to 11,500 people that die per influenza or per winter season. And that's a lot of folk. Now, it is the highest risk of death is obviously in the elderly, so the very old, the very young, and of course, as with COVID, those with comorbid conditions. So the smokers, those who have lung disease, chronic obstructive airways disease, emphysema, heart patients, kidney patients, they're more at risk. So influenza is by no means something that we can play with or even take lightly, because it does cause death.
So one thing that we've learned with the coronavirus is that there are strains. Is that the same for influenza?
Yes, Peter. So the two common subtypes or groups of influenza is influenza A, which is H1N1, and then influenza type B. B is not as common, does not cause the outbreaks as much as influenza A. And then there are also strains that we see that come from the northern hemisphere with their winter. And hence, if you look at the box, if you're about to take your flu vaccine, you'll see that there are mainly two types. There's a trivalent and a tetravalent. So the one with tetra means 4, tri obviously 3. So those protect you against the 3 commonly anticipated strains for this year. The tetravalent, 4 of the anticipated strains for this year. So it is quite a comprehensive vaccine and giving broad coverage for all the strains that are anticipated for the winter season.
Which is more contagious, influenza or COVID-19?
So that's an interesting question. If you look at the reproductive rate, it looks like COVID is probably more contagious, and this is why we talk about these super spreader events. But having said that, influenza is just as it is highly contagious. You know, one kid can infect a whole classroom. We can close down a factory because of it. It may just not be as fatal as COVID-19, but it is high up there in terms of transmission.
Do we know why it's more prevalent during the winter cycle?
Yes, so what happens in winter, the viruses survive better in colder temperatures. And when it's cold, Peter, what do? We keep ourselves generally indoors, and the first thing we do is we close all the windows. And the same thing in classrooms, in one's place of employment. So the combination of having better survival for these viruses and being in an enclosed space. And if someone there inside there is coughing and spluttering and they're not coughing into their elbow and they're transmitting these droplets into the air, it creates a perfect environment for the spread of influenza.
Does it spread in the same way as COVID-19? You've talked about coughing, but what about surfaces and door handles and things like that?
Yeah, now when we talk about door handles and surfaces, influenza is probably much more virulent or transmittable compared to COVID-19. COVID-19, close contact, spreading the germs through coughing, sneezing, runny nose. This influenza can survive on surfaces. Now you think about it, you're coughing, you don't wash your hands, you go to the photocopier and you do something there, you touch everything, your colleague comes along, the virus is still there, they touch the machine, and during the course of the day, rub his eyes, rub his nose, coughs, or just puts his hand in front of the mouth, he can be transmitted with influenza. So with surfaces, it is very, very important. Keep your hands clean, keep it sanitized, wash your hands regularly, wipe down surfaces because the germ can survive there and cause transmission of the main way is always through the droplet spread, the coughing, the sneezing. And if you put your hand in front of your mouth and you carry that germ there and you shake somebody's hands, boy, they will get influenza, definitely.
All right. I think you may have answered this question already, but just to be clear, who's probably more vulnerable to influenza and the more severe symptoms of it?
Yeah, so there's two aspects there. I think we are all vulnerable to getting influenza, especially if we haven't been vaccinated. However, as with COVID-19, there are certain people, when they do get influenza, they may get severe illness. So it's usually the elderly over the age of 65, it's usually the younger under the age of 5, and then everyone else in between who has comorbid conditions. If your lungs are bad with asthma or smoking, if you have a heart condition, if you are diabetic, if you have any immunocompromised state, you have a higher risk of getting more severe disease with influenza, and therefore being more critical or higher chance of death compared to someone who is vaccinated.
All right, let's talk a little bit about prevention, because prevention is better than cure. And COVID-19, we know you can't cure it, and that the vaccines, what they do is help you recognize it quicker and fight it quicker. Is that the same with the flu shot?
Absolutely. So as at least with influenza, the treatment is mostly what we call supportive, conservative treatment. So treatment for pills for the headache, for the body aches and pains, lots of fluid, bed rest, important. There are, compared to COVID-19, there are antiviral medications that are available that one can take, a 5-day course that can shorten the duration of influenza, minimize the symptoms of influenza. So we have better treatments available compared to COVID-19. But by far, the best way as with COVID, the best way of preventing influenza is the influenza vaccine. No doubt about it, no question about it. And then masking and washing and keeping your hands clean and avoiding touching surfaces and staying away from someone who could be sick. But the vaccine is the primary preventative tool for influenza.
So when should we be taking it, and how long do we get cover in terms of its efficacy?
Okay, so as you can see, there's a drive every year from February, March, and one has to get a new vaccine because there are usually new strains with every flu season. So if you had the flu vaccine last year, it is of no value for this season. It expires after a year. So we start highlighting the fact that everyone needs the vaccine by February, March, and we want everyone to be vaccinated at least by the end of April. We do say it's never too late, but the flu epidemic usually starts with the winter months. So by May, June, July, you want to be fully protected. Bearing in mind, Peter, that the flu vaccine takes at least 10 to 14 days to kick in, as it were, for you to have efficacy against prevention of influenza. So you have to have that time period. But I'm encouraging everyone, make sure that you get your vaccine this month.
All right, so it's never too late though. And I guess in a COVID environment, you're probably saying this year more than any other year, it's critically important that we take the vaccine shot for flu. Why?
So a number of reasons. One, obviously, you don't want to have a twin epidemic or twin infection, getting influenza and COVID-19. Secondly, at least if you have the influenza vaccine, it's easier to make a diagnosis. So if you get sick and you've had the vaccine, it's most likely not related to flu. So it's easier to make a diagnosis of COVID-19. 3, the burden on the healthcare system. So you can imagine how many people, if they do not get vaccinated and get influenza, could potentially land up in hospital and put an added strain on the healthcare system, hospitals, manpower, and we need to reserve those beds for those who get severely ill with COVID-19. And so for those reasons, it's important that we distinguish influenza. We don't want people getting sick. We don't want them landing up in hospital. It's easier to make the diagnosis if they have the vaccine. And you can imagine if someone gets co-infected with influenza and COVID-19, the severity of that kind of scenario.
And I'm guessing also, because when we talk COVID-19, we talk about the immune system. So if you've got flu, that lowers your immune system, and that probably opens you up a bit more to symptomatic COVID-19.
So technically, that's absolutely true. So one can have a more severe infection compared to if you just had COVID-19 on its own. So the interaction, they're both viral illnesses. They both affect the lungs and your respiratory system, and your body. There's a very good chance that your body and your immune system will just not be able to handle that type of viral load of two co-infections happening together.
All right. So with COVID-19, we all went to the pharmacy and stocked up on all sorts of pills and tablets, immunoboosters, you name it. We were putting it in the trolley. Is it the same for influenza?
Yeah, good question. No, I must say, over the years, patients come to me, no doctor, I've loaded up on the vitamin C and they're taking all these fancy herbs and spices. I've never seen any evidence that it helps, whether to prevent flu, and it's usually those who don't want the vaccine. No, they say, I've topped up on all my vitamins and I'm strong. There's no evidence that taking these added supplements will either prevent you from getting flu, or in the event that you get flu, not get a severe illness or long duration of illness. So my personal view is, compared to COVID-19, where we have data, especially with regard to vitamin D, for instance. Low levels of vitamin D potentially can cause more severe cold, so we want to boost your vitamin D levels there. But with the influenza, we don't have that type of data. So I'm not a big fan of patients pumping themselves with the vitamin C and all the other vitamins and herbs and spices in order to prevent influenza. My philosophy is the best prevention is a jab, is a flu vaccine.
All right, so bottom line, get vaccinated. That's your preventative support. And then if you do become symptomatic, then you treat the symptoms, whatever they might be. Typically, what kind of interventions do you do when someone comes and says, "Oh, doctor, I'm really sick. Flu's got me, man. What do I do?"
Yeah, so the first thing, I want them to be put into bed. They are very contagious, so you want to limit the exposure, and bed rest helps, especially with the headaches and the muscle aches and pains. Number two, it's very easy to get dehydrated, so they need copious amounts of fluids while they are in bed. Tell them not to worry about their appetite. When you get better, your appetite will come back. And then you want to manage the symptoms. So they may have a headache, so you want to give them simple analgesia for that. Body aches and pains, a simple anti-inflammatory for that. And sometimes if you want to, I don't really go for it, but a cough mixture just to relieve the coughing symptoms. I think what's very important to mention, Peter, is that antibiotics are of no value in treating influenza. Influenza is a viral illness, and yet many doctors, I'm sorry to say, many patients demand or expect to get an antibiotic. And they always use this line, well, yes, it's viral, but we want to use an antibiotic just in case it gets worse or turns into a bronchitis or pneumonia. That is bad medicine. So no antibiotics, absolutely no antibiotics in the treatment of influenza. I did mention earlier that there is an antiviral course of medication that is available, that is quite effective in shortening the duration and lessening the symptoms of influenza. But we do not give antibiotics. And bed rest and fluids, and it should settle nicely. But you will be sick, you will feel ill.
And I would imagine that we've got to be careful not to treat these conditions in the same way. There may be a temptation because the symptoms might be similar, but COVID-19 is COVID-19, influenza, and they require different protocols.
Absolutely, and I think it's going to be essential this year, Peter, especially in those who are not vaccinated. If someone comes in because of the overlap of symptoms, I mean, both can give headache, both make you chesty, Both can give you a sore throat. Both can give you body aches and pains. So it may be difficult to distinguish between the two just on clinical symptoms. So we may have to, in fact, what I do in my practice is to send them for a swab. Have a swab done, see if it is influenza or COVID-19. Because the ramifications and the implications are totally different, especially with regard to isolation, quarantine, etc., and risk factors for severe disease. So it's vital that we make the correct diagnosis and not just guess on the basis of what the patient is saying or seems to be saying. So we're going to have to distinguish between the two and give the right treatment appropriately.
All right, I'm told that we've run out of time, but I've got to ask you this because it's something that's always mentioned, and I think we can never mention it enough. Flu, colds, COVID, and exercise.
Yeah, such a good point. The advice is if you are having some sort of viral illness, especially where there is a temperature, especially where you are feverish and there may be muscle aches and pains, please, under no circumstance must you have any form of exercise. You have to rest your body until your body is completely recovered, and then for a few days, and then gently stop. And my advice to patients is very simple. You sacrifice a few days, you'll always be able to run again or go to gym. If you gym when you're sick because you're scared of getting out of the zone, you may damage your heart to the extent that you will never, ever be able to do any form of exertion ever again. So it's worthwhile just waiting it out, getting better, and then restarting your exercise schedule. So no exercise while you have a current viral infection.
Dr. Marlon McKay, always great talking to you, but I think we're going to chat again towards the end of the program when we look at COVID-19 in particular.
Thank you, Peter.
All right, that's your story on influenza, and one needs to be really careful, particularly this year, given that we're in a COVID environment. All right, I believe that you've been sharing your thoughts via Twitter, so let's take a look at some of those messages and the ones that you've been sharing, and they look like this. So Annie says, I hope people apply some of the logic that they're using for the COVID vaccine to the flu vaccine. It's free for most folks at any pharmacy, and by getting it, you protect vulnerable populations around you. Get a flu shot if you can. Thanks, Annie. Great advice. Mpo says, flu vaccine done and dusted while we wait for the COVID jab. Okay, well done, Mpo. Lisa says, I actually do get the flu vaccine every year and just got my 2 shingles vaccine shots last year. Those are personal choices, re my health. However, I've also gotten the COVID vaccine, not just for me, but for everyone in my community. Lisa, very well protected it seems. SJ Fiend Obsolete says, I'm not going to get the vaccine even though my 25-year-old insists. I've yet to get a flu vaccine and I get through flu season okay, and I'm pretty sure I had COVID before COVID was all the rage. Bottom line, when I'm sick, I stay away from people. Yeah, look, you know what? There's no harm in getting the vaccine, but there could be harm if you don't. Caroline says, so I will be eligible to be vaccinated in 10 days, but my 84-year-old dad still doesn't know if he can get the vaccine because of a bout of Guillain-Barré syndrome back in the late 70s, which means that he can't get the flu vaccine, which is why he doesn't know if he can get this one. Anyone know? All right, we'll put that question to Dr. McKay a little bit later on. T. Bailey says, I'm 36, I've had the flu once in my life. I never take the flu vaccine or any vaccine in general. Using natural methods is much more effective. Well, T. Bailey, I can tell you, you've probably had a lot more vaccines than you know from childhood going forwards. AP says, just got my flu vaccine. Am I supposed to post a pic and tell everyone, or just got my flu vaccine now? Yes, post a pic. We'd love to see you with a shoulder and an arm that's got vaccinated. D Junior says, ever since I stopped getting a flu vaccine, I also stopped getting the flu. Well, that's interesting. That's interesting. And I think a lot of people, as we were saying earlier, confuse flu with the cold, the common cold, and they're not the same thing at all. All right, now, after the break, we speak to Christine Phillips, a health coach and wellness chef, about foods that are available for people that can eat when they have flu and what to avoid in terms of flu as well. So stay with us. You're watching Health Talk. Welcome back. You're still watching Health Talk. Yes, we're in the middle of a COVID-19 pandemic, but the cold and flu season is also upon us, and it is here to stay for a while, it seems. Now, the good news is that there are natural remedies for cold and flu symptoms, and they're as close as your kitchen pantry or your refrigerator. Mother Nature has also provided us with natural and plant-based remedies that can help prevent illness or help you feel a bit better faster once you're already under the weather. Zama Buthelezi spoke to a chef about inexpensive foods available that people can eat when they have the flu and what to eat to avoid flu.
Christine, thank you so much for talking to us. Everything looks beautiful there, I must say. Talk to us about the must-have foods in your pantry as we approach the flu season.
Okay, so, as the seasons change, so do the various foods. So I'm all about eating seasonal foods, all right. So in summer, it's hot, so your body craves things like cucumbers and spinach and lettuce and things like that. But as the winter months creep in, our bodies require more sustainable foods, more nourishing and comforting foods. So things like sweet potatoes, pumpkins, butternuts, that kind of food is really beneficial for your body at that particular time. And what's great about seasonal foods is that it's a lot more economical. So buy in abundance, cook and freeze and use those kind of foods.
Christine, I see a lot of fruits, and as moms, we always have challenges, especially with our young ones, when it comes to vegetables and fruits. So how do we prepare them in such a way that they are attractive for our young ones?
I have a little tip when it comes to greens. For some reason, children see greens as soon as they see green, they don't want to eat it. It's important to keep those greens brightly colored. Don't overcook them. And I find a lot of people do overcook their beans, their broccoli, and their peas. Those green vegetables only need to be literally just splashed into hot water or boiling water for like 1 minute, and that is it. Then take it out because it carries on cooking afterwards. So I think when it's nice and bright and colorful, it's a lot more pleasing than when you've got this brown broccoli or brown green beans. No one wants to really eat those.
I see, Christine, you have a lot of fruits there and vegetables, of course. Tell me, we see a lot of people in winter complaining about the sore throat and the blocked nose. Let's just do the sore throat first. What food concoctions can we use for sore throats?
You want to have things like lemon, ginger, garlic, honey. Those are fantastic for helping with flu. Now, my little trick, and I tell all my clients all the time, something I do every single day of my life, and that is have lemon and hot water when I wake up every single day. So I start my day off with lemon and hot water. You can add a little bit of honey to that if you want to, or some grated ginger as well. That is just a fantastic way to start the day, and it actually just clears you and keeps that flu away. Honestly, it's amazing how it works.
Talk to me about the vitamin C. I read somewhere that if you eat oranges, you're getting pure vitamin C compared to supplements. How true is that? And what are the benefits of eating oranges or freshly squeezed orange juice?
Well, I think most fruit have got all the vitamin C that you need. I think whatever you can get your hands on, it doesn't have to be oranges, but, oranges are great. Lemons have just as much vitamin C as your orange. I think it's important to just constantly eat fruit. It's important to have a lot of fruit during the day, and it is better than a supplement. But the quality of our food isn't like it used to be. So sometimes we need a little bit of added supplements, or many people aren't actually eating like this array of fruits and vegetables every day. So if you're not eating your fruits and vegetables, then you might need to supplement. But there is nothing better than the real thing. Real food is what gets you healthy.
Christine, I know that when someone has flu, I know with myself, then I don't have an appetite at all, and I have to take medication. Sometimes it's even antibiotics. And now with COVID, people are isolating at home, and you have to eat and take a lot of medication and steam. What would be your advice to people who are isolating at home? What should they eat to make sure that they boost their immune system while they are on treatment for COVID and influenzas?
Now, because you're not so hungry, it's important to try and do very small meals more frequently if possible. So things like soup is fantastic, and smoothies is great, because then it's nice and soothing going down your throat. So just a small amount. You don't need to eat huge quantities, but rather just have small, frequent meals when you're not feeling well. And again, put things like nuts and seeds, nut butters, avocado, and like sweet potatoes into your diet, because that gives you a little bit of a boost of energy as well when you are feeling flat and have no energy to pretty much get up.
Christine, thank you so much. I really enjoyed this interview. And post-COVID, I'm looking forward to seeing myself in that kitchen where you will be showing our Health Talk viewers and myself how to prepare those beautiful healthy meals that you do. Thank you so much.
If only I could cook as well as the chef in that kitchen there. And I'm sure that this will be gone and I wouldn't get flu. Anyway, we're going to take a quick break, and after that we're going to get your COVID-19 questions answered. I know a lot of you post these questions on social media, and anybody answers in there. Most of the time they're not even doctors, but we're going to get you professional information after this, so stay with us. Welcome back. You're still watching Health Talk. Now, as most countries around the world continue to roll out vaccine programs, sadly, and we know this for sure, there's still no cure for the virus. And what we've started to see is that people are going online to try and get advice and information about symptoms. And they're not always getting the right kind of advice, sadly. So what we are asking now is getting our GP, Marlon McKay, to answer some of those questions that you've been posting on social media. Okay, Marlon, thanks very much indeed again for joining us. You saw a number of tweets coming through after our conversation, and I think some of those raised some questions for you.
Yes, so I just want to clarify one or 2 points there quickly, Peter, if I may.
Yeah.
Firstly, the flu vaccine is an inactivated, it's a dead vaccine. So it cannot cause flu, it cannot make you sick. You may get a bit of a sore arm, a bit of a temperature, but it cannot give you flu, being an inactive vaccine. Also remember, the vaccine takes about 2 weeks to kick in and to give you that immunity. So if you get sick in between, up to 10, 12 days after you've had the vaccine, it cannot be from the vaccine. It's something that is new, was already brewing there in terms of the incubation period. It's unrelated to the flu vaccine. So I think we must be careful of giving the flu vaccine a bad name and blaming. And then, of course, as you mentioned, the definitions. People say, I took the flu vaccine and I got flu. But if you analyze the symptoms, it was probably just a cold or even some sort of sinus or upper respiratory thing. So the flu vaccine cannot give you flu. And then the only people who should not take the flu vaccines are those who have a specific allergy to eggs. For anybody else, it's safe. Even in pregnancy, the vaccine is safe and highly recommended. With the gentleman with the Guillain-Barré, if the Guillain-Barré was directly related to a vaccine, then they must discuss that with the doctor. But even there, the risk, the benefits of taking a flu vaccine far outweigh the risks. So don't hesitate, vaccinate. Thank
All
you.
right, fantastic. Okay, let's go straight to those tweets now, and we'll fire those questions for you. The first tweet is coming up, and it's from Riranzu, who says, "Good morning, survivors. I don't know about you guys, but I am so nervous about the third wave that's coming. Please, let's share ideas on how to keep our immune system strong besides steaming and drinking ginger. What can we do to stay strong? What type of food? What type of medication? Support group? Anything?"
Yeah, so I think let's just remember the basics. There's nothing that you can do specifically outside of the normal protocols to prevent you from getting COVID. You can't eat yourself to prevent getting COVID. What you can do is to look after yourself to prevent yourself getting severe COVID in the event that you become infected with the SARS-CoV-2 virus. So do not forget the basic. Masking, social distancing, keep your windows open, washing your hands. That's going to prevent you from getting it. If you do get it, yes, you're topping up on the vitamins and the steaming. That will help you from getting severe COVID. So just distinguish between those two things.
All right. Norman Julius says, "I tested positive for COVID yesterday and have experienced all the flu-like symptoms, but I have a question regarding one specific symptom I've experienced, and I want to know if anyone else has experienced it or if someone can explain why I'm experiencing it. When my fever started to set in, I started having these muscle spasms, convulsions in my abdomen. At first, I thought it was the chills, but they got really violent and haven't stopped for more than 10 minutes since I started getting really sick. Now, tonight I feel better already. I have no fever, but the spasm convulsions are not going away. Even my flatmate's dad and boyfriend, who all have had COVID, have not had this with their symptoms. Is there anyone who can explain this?"
Yeah, I must say that's the first time I hear of that type of presentation. It's obviously not very common. It could well be due to probably an electrolyte deficiency, something like potassium, magnesium, calcium that can cause that. But we also know that the virus does cause muscle inflammation, and part of that inflammation, myositis, could be the fluttering or the tremor that one manifests. It could also be part of the temperature. So the mechanism is a little bit unclear. But it's very, very interesting to know that this can be part of COVID. I've never seen it before.
All right. And then Matsokola says, "I'm on warfarin for blood clotting. My left leg has clots, and it looks like warfarin interacts with almost everything. I shouldn't take garlic and ginger and most of the herbal medicines. I also had to stop taking my supplements. Any advice? Because now I have a flu, I'm coughing, I don't know which medication I should buy, multivitamins, supplements."
Yeah, so warfarin to keep the blood thin to prevent clotting, it can be very, very challenging. There are specific lists of drugs where there are interactions, and these would include especially your anti-inflammatories when you have a cold or flu and your muscles are sore. The green leafy vegetables you want to avoid as well. But if you speak to your pharmacist, and the pharmacist knows, they'll be able to guide you in terms of whether it's cough mixtures, cold and flu remedies. But any combination pills, I strongly suggest that you avoid. Be careful of the supplements. So yes, we may be limited in terms of what you can take, but that does not mean that there's nothing that you can take. And so if you need advice, that's where your pharmacist comes in, who can tell you what is safe. It may not be the best, but it will be safe for you to take.
All right. Marlon McKay, thanks so much indeed for joining us. Always good talking to you. Have a great week.
Thank you, Peter. Thanks for having me again.
Thanks.
Bye-bye.
All right, okay, so that's our regular GP talking to us about COVID-19 and so on and so forth. But that's where we're going to come to the end of today's edition of Health Talk. Thanks very much indeed for joining us. Please, as Marlon McKay said, do not hesitate. Vaccinate. Get that flu jab. Really, really important, particularly in the middle of COVID-19. And also follow all the other protocols. Until next week, take care, be safe, and take care of each other. Bye-bye.